This week, Portland Police Chief Jamie Resch reported another troubling statistic. 911 calls for suicide attempts or threats are up 41% from this time last year. She worried it is a sign of the times as people in Oregon and Washington and people around the country are told to stay home, change their routines, and for many people, give up their jobs. Dr. Robin Henderson is a psychologist and director of behavioral health for Providence in Oregon. We wanted to talk with her this morning about ways to manage some of the fear and the anxiety that so many people are having about this virus. Doctor, good morning.
Good morning.
So this has been a tough time for people, and I think we are really now starting to see in some of the calls from police and some of the research we're getting how people are reacting here. What kinds of things are you seeing at your practice?
Well, amazingly, it's been rather quiet. And we've been talking about, the calm before the storm, but I think it's quiet because people don't know how to access help. We're all told to stay home, we're all told to, shelter in place, but people need to know help is there and it's right on your phone.
Yeah, I think one of the things that, that's not shutting down, obviously, is healthcare workers. And in this
Right.
case, there are still a lot of people available to help, even if it's not face to face. What are some of the options for people right now?
Well, all of the urgent walk-in centers, Clackamas County, the Hawthorne Center in Washington County, and of course Cascadia in Multnomah County, are open for business. And while you can't walk in and see somebody face to face, you can call their hotlines and speak to somebody today. At Providence, all of our therapists in primary care, all of our psychologists are now available via telephone. So you can schedule an appointment with your psychologist in primary care just by calling the primary care clinic. All of our clinics are open, again via tele, including our partial hospital and our intensive outpatient programs. We rapid cycle took everything virtual in less than a week.
Wow. Robin, I think a lot of parents are struggling right now with how to
Mhm.
talk to their kids. Obviously they're home, they're off school, and for some younger children, they might not fully understand why. What are your suggestions for how to have those family conversations?
Those are conversations you're going to have probably every day for some time because every day kids are wondering, why can't I go outside? Why can't I play with my friends? You can go outside and take a walk. You can go outside with your family, and you should. But playing with your friends and having those social interactions are conversations we're going to have every day while we explain that staying home is how we stay safe. How we keep the people we love safe is by staying home and staying away from them. But that doesn't mean that you can't contact them. What we're doing right now on FaceTime is what we should be doing with our friends and our family and our extended circle every single day. Having that virtual coffee, having a storybook time with your grandparents or other loved elders and things like that are things we need to do to stay connected.
Yeah, I think that's something that everyone is kind of adjusting to. I'm having to get in the habit now of getting the phone out when I'm sitting down for dinner and
Yep.
calling mom and dad. So, for people that are maybe just feeling a little more stressed, they're not sure that they need to talk with a medical professional, but they just want to kind of correct that thinking. Any just easy advice for ways to kind of calm those nerves day to day?
We call it, kind of have to shift your mind shift, right? So if you're thinking, gosh, I'm isolated, I'm at home, I can't do anything, remember that you're staying safe. If you're not connecting with people, think about what you can do every day to connect with somebody new. I have talked to more old friends in the last week than I've talked to in the last year because they've just picked up a phone and called and said, "How are you doing?" And trying to make that effort to do that for people that you need to connect with is what's going to keep you from feeling isolated and alone. There's also a lot of great resources online. Providence has a website that's set up about specific to coronavirus, but we also have something for teens, parents, and educators at our new worktobewell.org site that has all kinds of information about how to create your own self-care kit, how to deal with anxiety, how to deal with depression, things like that, but also how to keep connected in the social media space.
Yeah, I think having some of those vulnerable conversations and reconnecting with people might be a little bit of a silver lining here. So we appreciate the advice. Dr. Henderson, thank you. We're going to have a link to all of Providence's materials and resources on KOIN.com. And remember, if you or someone you know is struggling, you can call the Multnomah County Crisis Line. We've got the number on the screen. That is staffed 24/7. They can also connect you with our other area crisis centers, along with the National Suicide Prevention Line. We have more resources for you now at KOIN.com.